Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Sarah Anderson. In this episode, we focus on a key community affected by hepatitis B virus infection, people of childbearing potential and their infants. I'm joined today by Dr. Joseph Ahn, Professor of Medicine and Section Chief in the Division of Gastroenterology and Hepatology at Oregon Health and Science University in Portland, Dr. Christina Delacruz Leyson, Associate Professor and Medical Director of the Liver Transplant Program at the University of Kentucky in Lexington, and Alice Chan, a person who experienced pregnancy while living with chronic hepatitis B. They will discuss their solutions to overcoming barriers to HBV care in this key population. To follow along with the accompanying slide set, please visit the link in the show notes for this episode. Now, let's get started and hear what Dr. Ahn, Dr. Leyson, and Ms. Chan have to say about HBV care in people of childbearing potential and their infants.
I'll start off the discussion with hepatitis B screening and vaccination in pregnancy. Preventing perinatal hepatitis B transmission is a key component of the U.S. strategy to eliminate hepatitis B. The level of maternal viremia really correlates with the risk of transmission, with very high levels of viremia conferring the highest risk for transmission. Thus, the CDC recommends universal screening of all pregnant persons for hepatitis B surface antigen during each pregnancy. So I just want to start with this discussion in terms of what barriers may prevent patients of childbearing potential and or pregnant people from being tested for hepatitis B. I wanted to include our panel, Dr. Ahn and Alice. We'll start with Alice. As a patient, did you see any barriers during your childbearing period or years or during pregnancy from getting tested?
Yes, there's a lot of barriers that will be associated with a pregnant woman. And especially for myself, and at that time, I was kind of a lot of stigma being involved to kind of find out that I am HBV positive, even though by the time my doctor did the testing on my first pregnancy, find out I was positive with HBV. And at that time, I was really scared and fear of isolations and feel like I am unclean because based on my upbringing culture, that hepatitis is an infectious disease. Is very strongly associated with the stigma. And we don't talk about it, even though in my families, that they never mention about any infectious disease. It seems like it is kind of bad luck and will kind of jinx you. And so my hepatitis B chronic carrier, probably I got it from my mom. So definitely the stigma of the cultural and also the linguistic part of it, is a heavy impact for getting, tested and also aware about what's going on with your body being a chronic carrier.
Well, I think as we've heard from Ms. Chan, we know that there are barriers from multiple aspects to prevent people from getting tested. I think from a patient standpoint, we've really eloquently heard about the fear and stigma associated with having the disease itself. Once being identified as having the disease, it can lead to a significant worry and fear about what this might mean for themselves, as well as the baby in their womb. In addition, I think even before we get the fear and stigma, there's a lack of awareness and education within the community itself that contributes to this fear and stigma. And so that's something that remains a significant barrier. And then there's this aspect of cost and time in the midst of finding out one's pregnant, then finding out that they have chronic hepatitis B. Then there's additional tests which take time and money. And I think that's a practical aspect that can also be a barrier. So that's from a patient perspective. From a physician perspective or a provider perspective, there's also barriers because they may not be aware or be updated in their education to know that patients should be tested and that they need follow-up, and also what to do once they're found to be positive. And I think from a systems perspective, the barrier is that if there isn't a system that catches the patients who are at risk and educates the providers, this leads to a systematic issues that act as barriers. So there's multiple aspects. patient, provider, and system that need to be worked on to reduce the barriers and improve access for testing and subsequent management and treatment.
Thank you, Ms. Jan, and thank you, Dr. An. Those were very good thoughts and feedback and summary of all the things that go on when deciding on, or even getting tested during childbearing period and pregnancy. And I agree, there are a lot of patients that are very hesitant and also not aware of particular impact of hepatitis B. And I think there's a lot of fear of that potential stigma. In terms of vaccination rates, how can we improve hepatitis B vaccination rates in patients who are unvaccinated, when those who are pregnant and childbearing potential? Let's start with Alice. During that time you were in that childbearing period or pregnancy, did you have any barriers in getting vaccination or having not really vaccination, or vaccination when you're in the childbearing potential, or did you, Dr. An, did you notice any barriers in having patients who are pregnant get vaccinated?
Well, for me, I think raise awareness is very important, because I wasn't aware about hepatitis B can be transmitted from mother to child. So by learning how did I get the HBV, and that was very kind of fearful and shock to me. And lack of education is one of the major role that play in the HBV elimination, especially for childbearing, a woman. And the other thing is about the normalcy of conversation, talking about hepatitis. Diabetes, hypertension is pretty common conversation, among the community. But talking about hepatitis, seems like everybody kind of bypass, this topic. If they see this topic is a taboo. And infectious disease definitely is not something that we talk about in the community. Well, with the recent COVID, it's just different. Everybody talk about it. So I think we have to really bring the conversation to a conversational level, in a daily basis. So people will have the knowledge, won't be kind of afraid of talking about it. And especially with, the childbearing age, populations. And they really need to be aware this is one of the leading cause for the perinatal transmission for the hepatitis B, and this is preventable. And educate them with all the effective vaccination and testing and diagnostic, even treatment. This is nothing need to worry about with the updated technology of science.
Yeah, I think continuing along with the discussions that Ms. Chan has put in, I think we go back to the factors that we've discussed previously: knowledge and education, access issues. I think the first part is that if there are barriers, it comes from a lack of awareness and a lack of knowledge, so that there's a lot of fear. There's misunderstandings about the disease itself. So the first part would be to increase the education, both of the patients, the community, as well as the providers. And to do that, I think practically speaking, we have to recognize the challenges of language limitations and also potentially cultural barriers, because we can't lump everyone into a big category of other and put, for example, African patients who are born in Africa all in one bundle, or Asian patients all in one bundle, because I think that misses the nuances of different cultural differences and barriers that might get in the way of both education and vaccination, and also the fact that there's a myriad of languages. So practically language-specific education and outreach that is culturally sensitive, I think these are practical ways. And this underlies this next concept, which is linkage to care, that we're going to talk about from both vaccination and treatment, which is we can screen people, but if we don't have a plan for follow-up for vaccinating those who need the vaccination or treatment for those who need treatment, it becomes really a empty effort, which doesn't lead to good outcomes. So linkage to care is the term that I think has been widely understood. and is important and responsible as part of the outreach and education process.
One thing I want to add on to the cultural and linguistic part, how we can overcome it, because a lot of time for the Asian American population, health literacy is a concern because they are low in health, literacy. And other than kind of like translate all the education material into their languages, they also need to be educated, about all the disease process, in the layman term. And then the other thing is regarding the cultural specific. A lot of the special populations, with their education and their knowledge. So I think the visual aid is very important other than the written. And also the color meant a lot to them too, like in the Chinese, We don't like to see a lot of blue or black or white, in the poster or in the pamphlet, because that can be a kind of like signaling something sad and, the end of life. So red, something bright color, it is good, So you have to consider all the cultural specific in order to approach to make the health education visual or either the video or either the written pamphlet to be more effective, to target a certain populations.
Thank you for that input. I think planning the educational materials, taking in consideration the culture and religion, are really key important aspects in improving awareness and, in the end, improving vaccination rates. And I agree with increasing the access and linkage to care. I agree that we do have a lot of difficulty getting certain vaccines, even the availability of vaccines. It's not universally available in all clinics, particularly hepatitis B vaccines. So these are all like public health strategies that has to be improved, improving access and education, obstetric clinics, primary care providers. I think these are all very good initiatives.
Yeah, and if I could continue along with what Dr. Leyson was saying regarding the vaccination and insurance, a part of the more of a systemic approach to this is efforts to include hepatitis B vaccination as a quality metric for outcomes that are tied to incentive care or outcomes care that we're shifting to, this value-based care that hopefully our future will hold. I think that aspect of quality metrics, also insurance coverage, and as Dr. Leyson said, the very act of getting a vaccine can be challenging if you're busy, if you have no insurance, and if you are in an area that really doesn't have ready nearby access of a place that offers vaccine, or if you have transportation issues. So as one can see, there are many challenges, but certainly this is an important aspect because primary prevention really is the most effective way for preventing downstream secondary and tertiary complications of hepatitis B.
I want to bring up a point, to piggyback on Dr. Arndt's about insurance. So based on what I know, that a lot of time the insurance may be only covered for pregnancy. So after pregnancy, there's a gap, in the coverage, for the postpartum mom. And so there will be kind of the lost track, to follow up with the mom and also with the baby on the coverage. So I think that's important for the healthcare providers and also the consumer to fill in the gap, of the continuum of care.
This part will be about managing patients who are pregnant who have Hep B surface antigen positive. That is, they have hepatitis B. And the goals of Hep B therapy or management in pregnant people are to recognize that we have two patients. First is the pregnant person in front of you, and the other is the infant in the womb. And first of all, as you look at this, our first responsibility is to make sure the mother is healthy, because a healthy mother will lead to the best chances for a healthy baby or a healthy infant. Therefore, if the patient has indications for Hep B treatment in and of itself, they should be treated to prevent liver-related morbidity or mortality, and long-term through viral suppression that decreases their risk of secondary complications. And treatment in this setting will be associated with the standard targets: normalization of liver enzymes, Hep B DNA suppression to undetectable, and if they're e antigen positive, e antigen loss. For those who get liver biopsies, the improvement in liver histology. Now, for the infant, the risk of therapy is secondary in that it reduces their risk of getting hepatitis B from vertical transmission. Now, let me ask our panel, how important do you think are the discussions about preventing perinatal hepatitis B transmission with people of childbearing potential who have Hep B and would like to get pregnant? Dr. Leyson, and then Ms. Chen.
Yes, these are very important discussions. This has very important impact in terms of educating and counseling our patients who do have hepatitis B who are planning to get pregnant. They will always have questions. How will this impact me as a mother during pregnancy? How will this impact the health of the fetus and the baby during pregnancy and postpartum and the delivery? How safe are medications? If I am on treatment, are these safe to take? So there's a lot of potential interactions or impact of pregnancy and the potential of having a baby in terms of counseling our patients. So these are very, very important.
Thank you, Dr. Leyson. Ms. Chen, I'd really love to hear your patient perspective.
Well, I was very lucky that my obstetrician at that time, it was very caring. And once I find out I have hepatitis B positive with the chronic carrier, he told me everything in detail. What will be the protocol to prevent the transmission, to the newborn, and also was informing me about how to protect my health. And so that is very helpful to alleviate some of the fear that I have, and especially about the transmission to my newborn. So he detailed everything about after the delivery, what my newborn will get, regarding the prophylactic treatment and the vaccine. So that was very fortunately, I have this OBGYN can follow through and also keep me informed. So that was a blessing.
Right. And I think that both of your comments point toward the importance of taking the time. The provider has to take the time to discuss with the patient, because oftentimes I find that patients are reluctant to bring up fertility and contraception in the setting of, for example, a liver clinic visit. And it takes extra time for the provider to do so, because one has to take the time to educate the patient and then collaborate. For example, if you're the PCP or the hepatologist or the obstetrician. So it is absolutely important to be proactive from a provider perspective, because there are challenges from a patient perspective from initiating this question. And I think we can move on to the second question here. What barriers may prevent a pregnant person from getting treated for Hep B during pregnancy? Ms. Chan, can you tell us your perspective, having gone through this yourself?
Well, first of all, I will ask, the doctor why I am the candidate, to be treated. So I need all the detailed information about what is the benefit of the medication that offered to me. And then I will also ask how long will be the medication being taken. And the last but not least is the most concern is the side effect on the newborn. So how that will impact, the babies regarding the medication I'm going to take.
Dr. Leyson?
Yes, I do notice several barriers that can potentially prevent a patient who is pregnant from getting treated. I think I've previously mentioned potential fears of the actual medication. So they would think that this medication would potentially be lack of awareness in terms of like the safety, the efficacy of medications for hepatitis B during pregnancy. Other potential barriers include access to treatment. So if they were not on medication before pregnancy, they're also concerned if their insurance will cover this. So we're talking about access to care again. Another potential barrier is the need to be monitored during treatment. And a lot of times during pregnancy, there's a lot of things that they have to plan for financially, their health. Having that extra requirement of getting tested frequently and potentially taking a medication. There are cultural, maybe religious barriers of getting treatment while pregnant.
Yeah, as we've heard, really it's the fear of the treatment. That is the treatment worth the benefits versus the risk? And I think this is the challenge of taking the data that we know and the guidelines that we know, and then explaining it to the patient so that they have a great, or at least they have a good enough understanding to be able to make that informed decision. And I think this also makes us think about there's challenges from a healthcare perspective. A healthcare professional may also have barriers in prescribing antiviral treatments during the third trimester for pregnant people who are indicated for Hep B treatment. Dr. Leyson, can you tell us your perspectives in prescribing antiviral therapy in this setting?
Yes. So the barriers that I have encountered or might potentially encounter in prescribing antiviral treatment during the third trimester, as I've mentioned, includes access to care. We know we do have a lot of difficulties getting medication approved. Their insurance might not approve it. There are certain formulary preference for patients' insurance. There also might be barriers of having the patient follow up. Some patients might not follow up. So there is a concern that, if you prescribe something, are they going to follow up if they have other issues going on with their pregnancy? I think those are the potential barriers from the hepatologist standpoint. In terms of being a healthcare professional, not being a hepatologist, potential barriers that I see would be lack of awareness of indications, the treatment option, the preferred treatment option, the side effects, and the monitoring, and how long this needs to be continued, and what's the monitoring before and after.
Thank you. I think a real barrier is the fear that by doing something that is giving a medication that they may potentially cause side effects or harm. There's also questions that the provider may field from the patient saying, well, what about impact on breastfeeding? Or as we'll talk about later, or getting into the blood, what about any risk to the baby and also to themselves? So this confluence of informing the patient, to giving them the choice, to having them to have the autonomy, having informed consent takes a lot more time. And I think that can be a barrier when you have limited time, seeing many patients in a day, and especially if there's barriers such as a language barrier, all the other barriers that we talked about. But certainly this is very important, both from a pregnant person standpoint and from a healthcare provider standpoint, to be aware of the data that underlies the guidelines, and to know that if there are indications such as greater than 200,000 IUs per milliliter, that person would benefit through tenofovir therapy to prevent vertical transmission.
So now let's jump to postpartum considerations. So we'll discuss infant care and breastfeeding. So to prevent maternal to child transmission, it is quite important to discuss infant immunoprophylaxis. Infants born to people who are surface antigen positive for hepatitis B should receive immunoprophylaxis. Hepatitis B immunoglobulin and hepatitis B vaccine should be administered to newborns of mothers who are hepatitis B surface antigen positive within 12 hours of delivery. So let me go back to our panel. I just wanted to ask our patient or parents, what are the potential reasons that parents may decline vaccine for hepatitis B of their infants? Ms. Chan?
I don't think there's a reason that they should decline to protect the baby against the HBV. And I think, unless there's certain religious reason that they refuse to do it, or either they are not being fully informed about the benefit of the HBV vaccine for the newborn. I think right now, I'm talking about in California especially, even all the children before they enter school, they will require to have the proof of the vaccine unless, there is a specific reason. Otherwise, the parents need to be fully informed this vaccine is being safe and effective to protect the newborn lifelong.
Dr. An, have you experienced any barriers in some of your patients who are parents who may potentially decline vaccination for their infant?
Yeah, I haven't personally, but I think part of that is that as a hepatologist, I'm not their pediatrician. So it's hard to know if they've had good follow up of the vaccines that their child should be getting. But what I do, and I think all of our providers can and should do, is to provide the full education. That is, what an important difference the vaccination will make in their child's life. That by vaccinating their child, it will protect them from the chain of transmission that has led the child's mother to have Hep B. To prevent giving that risk or that same burden of disease to their child, that the vaccination can prevent that. And when explained in that light and taking the time, I think I have not had any parents say that they don't want to vaccinate their child. There are people who have fear of vaccination adverse effects in general, and so that will affect all the vaccines, such as the coronavirus vaccine, et cetera. That is far and rare in my experience.
In terms of improving rates of vaccination for infants and immunoprophylaxis or prevention of maternal to child transmission, what are your thoughts about ways to improve rates of vaccination?
I'll comment on this. I think it has to be a systems approach. All of us these days are facing the effects of electronic medical records, and there are the upsides of electronic medical records in that it can alert the providers that a patient has hepatitis B. Therefore, their infant, upon delivery, there should be recognition of the need for Hep B vaccination and immunoglobulin. So a systematic electronic medical record approach. Secondly, I think the education has to start at the medical schools, nursing schools, and the APP schools so that they're aware of the risk of transmission and the impact of vaccination. So thirdly, the patient education awareness. I've talked to my patients to remind them, first, the provider may be aware. Second, the systems issue may be in place, but we really also need to have patients be their own advocates as well, as a way to make sure that they're engaged in their care and to help close any gaps that might approach, especially if the delivery is not going well or if there's a complication, it can easily be missed.
A system-wide or a public health initiative are really good ways to improve vaccination. And I think improving the laboratory system too, in terms of screening for it and having it reported is also quite important. Like when we order hepatitis B screening, it would be important also to include the word prenatal or having certain lab order sets that not just flags it as a hepatitis B positive, but also like having the pregnancy linked to it to increase our rates of systematic or system-wide vaccination rates improvement and public health initiatives. Ms. Chan, did you have any barriers in having your infant vaccinated and having the hepatitis B immunoglobulin postpartum?
Well, information is important to educate myself, how the immunoglobulin and the regular vaccine, the 3-shot series will do, because I wasn't that familiar with immunoglobulin at all. I know about the vaccine will protect. So kind of like myself and the parents, they need to have full information. And then the other thing is that I will tag on is regarding talking positively will help instead of telling me all the side effect. And I only want to hear about the benefit, what is good, how to protect the infant, the baby. And then the other thing, I think the timing is important. If the provider kind of rush it, kind of for the information, it's difficult for the patient to fully understand and feel like the caring from the providers. I know the PCP or the obstetrician, they have full load of patients, but still regarding these important matters, will be good came from them with some patience to educate the pregnant person or the new mom. And the other thing I want to tag on is like sometimes, the doctor will say, okay, now I'm going to offer you this vaccine or this prophylactic. So this is the person will call you or you can contact regarding detailed information. And that will have loss in the track because I have experience regarding, okay, somebody will call you. It's a pharmacy. and then call. And then by the time I don't have the trust is important, in building the relationship with the provider. Somebody who I trust will come from them. And then that's make a big difference, in the acceptance and also the compliance.
Thank you. I just wanted to add that I think there should also be increased education and post-vaccination serologic testing to check if they do develop immunity, which may potentially be lacking, or if they need additional vaccines. One last topic is about breastfeeding. I want to ask Dr. An and Ms. Chan. Ms. Chan first, do you have any concerns in terms of having to breastfeed and about the risk of breastfeeding?
That was my question for my OBGYN at that time. And then I was reassured the breastfeeding regarding a chronic carrier, does not really impact the breastfeeding. So I'm kind of like really confident, based on what the information my OBGYN was informing me, because I trust him very much, at that point. So that wasn't a concern for me to have the breastfeeding at the postpartum time.
Yeah, and my counseling for the patient who's postpartum is to emphasize the importance and the benefits of breastfeeding. I think the obstetricians can also elaborate on that, as well as the pediatricians, but it's widely and clearly recognized. And so I tell them about that. And secondly, I address two fears. One is the fear of transmission of Hep B itself during the breastfeeding. And then secondly, the fear of the medications being transmitted to the baby if they are on antiviral therapy. And I tell them that for both of their fears, it is very reasonable fears to have, but that the risk of the transmission and the risk of any side effects from the medications is very, very low, in contrast to the significant benefits that the breastfeeding will have. So I go over the data that is available of the medications that we have to say that the risks of any side effects to the baby are negligible and very, very low, but that the benefits of breastfeeding is very high. And thus the risk benefit is very clear toward recommending breastfeeding, and that the risk of transmission during breastfeeding of Hep B itself is unlikely and negligible, especially if the baby has had the vaccinations and immunoglobulin. So it goes to reinforce the importance of vaccination and follow-up, and that the baby will need ongoing follow-up to make sure that they complete their series of their Hep B vaccinations.
Thank you, Dr. An, and thank you, Ms. Chan.
I'd like to thank all of our faculty, Dr. An, Dr. Leyson, and Ms. Chan, for that excellent discussion, and thank you to our listeners for joining in. As a reminder, to view the slide set for this podcast and the full program on HBV care in key communities, minimizing barriers and optimizing care on the Clinical Care Options website, click the links in the show notes for this episode. Other key communities addressed in this program include Asian American people, African immigrant populations, and older adults living with hepatitis B. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.